Every year, the flu kills up to 650,000 people around the world. Not a rare disease, not a war. A virus that almost every person alive has experienced, and yet most people still do not know the truth about it. Today, I am going to change that for you. Hello everyone, and welcome back. I'm Dr. Christopher, and if you are new here, welcome to this channel where we break down medical information in a way that every person can understand, use, and share with the people they love. Before we dive in today, I want to ask you, if this video gives you even one piece of knowledge that protects your health or someone else's, please hit that subscribe button and turn on the bell notification. Every subscriber on this channel is someone who has chosen to take their health seriously. And that means the world to me. Now, let us talk about the flu. Influenza, which most people simply call the flu, is a respiratory illness caused by influenza viruses. And I want you to understand something right away. This is not the same as a common cold. This is not just a bad cough. Influenza is a serious, sometimes deadly illness that sends millions of people to hospital every single year, and it deserves your full attention. There are 4 types of influenza virus, A, B, C, and D. The one I want you to remember is Influenza A. This is the type responsible for every single pandemic in recorded history. The 1918 Spanish flu that killed 50 million people. The 2009 swine flu that swept the globe in months. Influenza A mutates rapidly. It changes its surface proteins called hemagglutinin and neuraminidase, which is why you hear terms like H1N1 or H3N2 in the news. These mutations are why the flu vaccine must be updated every single year. Your body's memory from last year's flu may not protect you this year. That is not a flaw in the science. That is the nature of this virus. Influenza B is more stable and mostly infects humans, circulating every flu season alongside Influenza A, particularly dangerous for children. Influenza C causes mild illness. Influenza D primarily affects cattle. But A and B are what we face every year, and they deserve your full respect. Now, how does the flu actually spread? Through respiratory droplets. When an infected person talks, coughs, or sneezes, tiny particles of moisture shoot into the air and can travel up to 6 feet. If those droplets land in your mouth, nose, or eyes, the virus enters your body. You can also pick it up from contaminated surfaces. The flu virus survives on hard surfaces for up to 24 hours. On your hands, it can remain active for 5 full minutes. This is why I tell every single patient, wash your hands. Not a quick rinse, 20 full seconds with soap and water. That single habit has saved more lives than most medications every day before your symptoms appear. You feel perfectly fine. You go to work, you hug your family, you shake hands, and you are already spreading the virus. Once symptoms start, you remain contagious for 5 to 7 more days. So how do you know if you have the flu? Let me give you a clear picture, because confusing the flu with a cold can be genuinely dangerous. A cold builds slowly, a little sore throat, then a runny nose, then a cough. It takes 2 or 3 days to develop. The flu is completely different. The flu hits you like a wall. 1 hour you feel normal. The next hour you are hit with sudden, intense exhaustion. Your muscles ache so deeply that even lying still is painful. Your temperature spikes, often between 38 and 40 degrees Celsius. Chills shake your body. A harsh, dry cough begins. Your head is pounding. That sudden, dramatic onset is the flu's signature. Learn to recognize it. The classic symptoms are sudden high fever, severe body aches, extreme fatigue, dry cough, headache, sore throat chills, and sweating runny or stuffy nose. Children may also experience vomiting and diarrhea. Though this is less common in adults, for most healthy adults, the flu resolves within 7 to 10 days. The fever usually breaks within 3 to 5 days, though fatigue and cough can linger for 2 full weeks. But, and I cannot stress this enough, for certain groups of people, the flu is not just uncomfortable, it is life-threatening. Adults over 65, children under 5, pregnant women, people with diabetes, asthma, heart disease, kidney disease, or a compromised immune system, these individuals face a dramatically higher risk of serious, sometimes fatal complications. What complications am I talking about? The most feared is pneumonia, an infection of the lungs that can be caused directly by the flu virus or by a secondary bacterial infection that takes advantage of your weakened immune defenses. The flu can also trigger myocarditis, inflammation of the heart muscle, even in people with no previous cardiac history. It can cause encephalitis, inflammation of the brain. It can push chronic conditions like asthma or COPD into crisis. In children, a rare but extremely serious condition called Reye's syndrome can develop, and this is critically important. It is associated with giving aspirin to children during a viral illness. Never give aspirin to a child with the flu. Use paracetamol instead. Go to a doctor or emergency room immediately if you see difficulty breathing, persistent chest pain, confusion or altered mental state, bluish lips or face, symptoms that improve and then suddenly worsen again, or in children, inability to wake up, extreme irritability, or refusal to drink fluids, these are emergencies. Do not wait them out at home. Now let us talk about what happens when you go to a doctor. A good clinician will ask you when your symptoms started because timing is everything. They will check your temperature, listen to your lungs, and measure your oxygen saturation. If needed, they will perform a rapid influenza diagnostic test, a quick nasal swab that gives results in about 15 minutes. A more accurate option is the PCR test, which detects the virus's genetic material. In many cases during active flu season, an experienced doctor can diagnose influenza from the clinical picture alone, the sudden onset, the specific pattern of symptoms, the time of year. If your symptoms started within the last 48 hours and you are either high risk or seriously ill, your doctor may prescribe an antiviral medication. The most common is oseltamivir, known by the brand name Tamiflu. It works by blocking the virus from replicating and spreading through your body. Taken within 48 hours of symptom onset, shorten illness by 1 to 2 days, and more importantly, significantly reduce the risk of dangerous complications. There is also Zamivir, which is inhaled, and Baloxavir, a newer single-dose tablet option. Antibiotics do not work against the flu. The flu is a virus, not a bacteria. Taking antibiotics for the flu fails to help you and contributes to antibiotic resistance, one of the greatest health crises of our time. Please never self-prescribe antibiotics for a viral illness. So what can you do at home? For uncomplicated flu and otherwise healthy individuals, home care is entirely appropriate. The most important thing, and I mean this as a doctor, is rest. Real, complete rest. Not working from your laptop in bed. Not scrolling for hours. Your immune system requires enormous energy to fight this virus, and every bit you spend elsewhere slows your recovery. Sleep as much as your body demands. Your body is not being lazy. It is healing. Hydration is your second essential tool. Fever accelerates fluid loss through sweating. Drink water, warm broths, herbal teas, electrolyte solutions. Avoid alcohol and excess caffeine. Warm liquids also soothe the raw throat and help loosen mucus. For fever and body aches, paracetamol or ibuprofen are your reliable over-the-counter options. Use them as directed. Ibuprofen should be avoided during pregnancy and in those with stomach ulcers or kidney issues unless specifically advised by your doctor. Now, home remedies. I know many of you have been raised on these traditions, and I am going to be honest with you about what the evidence actually says. Chicken soup or broth, not just a myth. It contains compounds with mild anti-inflammatory properties. It hydrates you, warms your airways, and loosens nasal congestion. Research has shown it may gently inhibit inflammatory immune activity. Honey, particularly raw honey, has proven antimicrobial properties and is one of the most evidence-supported natural remedies for soothing a cough and sore throat. One important caution, never give honey to children under 12 months due to the risk of infant botulism. Ginger tea reduces nausea and provides warmth and comfort. Garlic contains allicin, a compound with antiviral and antimicrobial properties. The research on its direct effectiveness against influenza is still emerging, but there is no harm in including it in warm food. Steam inhalation, breathing warm moisture over a bowl of hot water, optionally with a few drops of eucalyptus oil, temporarily relieves nasal congestion by loosening mucus. Saline nasal sprays or rinses clear the nasal passages and genuinely reduce symptom duration in clinical studies. What about vitamins? Zinc lozenges taken at the very onset of illness may modestly reduce duration when taken consistently. Maintaining adequate vitamin D levels year-round through sunlight, diet, or supplementation is associated with reduced susceptibility to respiratory infections. Vitamin C supports immune function as part of a balanced diet, though high-dose supplementation has not been proven to cure or prevent the flu in well-nourished individuals. The most powerful weapon we have against influenza is the flu vaccine. Every year, the world's top virologists and epidemiologists analyze which strains are circulating and update the vaccine accordingly. It does not contain live virus. It cannot give you the flu. What it does is teach your immune system to recognize the virus before you encounter it. So when you do, your body responds swiftly and powerfully. Even in years when the vaccine's match is imperfect, it reduces severity of illness, reduces hospitalization, and saves lives. Getting vaccinated protects not just you, it protects everyone around you who cannot be vaccinated due to medical conditions. That elderly neighbor, that newborn baby, that immunocompromised colleague. Your vaccine decision is never just about you. For prevention in daily life, wash your hands frequently with soap and water for 20 seconds. Use an alcohol-based hand sanitizer when soap is unavailable. Cover your coughs and sneezes with your bent elbow, not your bare hand. Avoid touching your face, especially your eyes, nose, and mouth. Ventilate indoor spaces. And when you are ill, stay home. This is not weakness. This is wisdom. This is responsibility. The flu spreads because people feel they cannot afford to rest. I am telling you as a doctor, you cannot afford not to. Understanding the flu is not just medical knowledge. It is knowing yourself well enough to recognize danger before it becomes a crisis. It is knowing that the person beside you may already be contagious without knowing it. It is knowing that a vaccine is not a debate. It is a tool built on decades of science that has saved hundreds of millions of lives. The flu is ancient. It will always return. But knowledge, real, honest, practical knowledge, that is the thing that protects you, your family, and your community. And that is exactly why I make these videos. If this video helped you understand something important about your health today, I have done my job. But I want to keep doing this job for you, for your family, for every person who deserves clear and honest medical information. So please, if you have not already, hit that subscribe button right now. It takes 2 seconds, and it means that every time I put out a new video on topics just like this one, you will be the first to know. Share this video with someone you care about, because the best medicine is knowledge, and knowledge shared is health multiplied. I will see you in the next one. Stay safe, stay informed, and take care of yourselves. This is Dr. Christopher, signing off.